My name is Cindy Yelle, and I have the privilege of serving as President and CEO of the Toronto Rehab Foundation. And our foundation puts on these breakfast seminars, information sessions for all of you quarterly. After today's session, I'm going to start off with this. After today's session, you will have the opportunity to tour the world's #1 research labs dedicated to rehabilitation. They're called the IDAP labs. They flank the penthouse. They're in the penthouse, the top floors of this university center, and also underground, 4 stories, 5 stories underground, again in this facility. I want to acknowledge my esteemed colleague, Dr. Jeff Fernie. Jeff, if you could stand up for a moment, please. Dr. Fernie is the Director of Research here at the Toronto Rehabilitation Institute. He has been so now for, I always get this wrong, is it 14 or 15 years?
Almost 15.
Almost 15 years.
We last that long.
We will. Over the past 15 years, Dr. Fernie has developed research capacity, research facilities here at the Toronto Rehabilitation Institute that are now considered #1 in the world. And I often say that people who have been here before have heard me say this, that there really aren't that many organizations in Toronto, actually not even Canada, public or private, that can claim #1 status, #1 first class in the world status. But right here at Toronto Rehab, thanks to Dr. Fernie and his colleagues across this institution, we can. And so we take great pride in that. I encourage you, if you have not seen our research labs, to tour with us a little bit later this morning. So let me go to script here a bit, and then I'm going to share a very personal experience. I'll try to be brief. So this morning's session is on tackling pain and the opioid crisis, which we all know is, we've been saying, it's coming. Well, guess what? It's here. Before I get really into the meat of the matter, I would like to acknowledge the sponsor of today's event and all our previous events, these morning series, and it's Liquorland Capital Corporation and Bob Blakely. Bob's chair of the Toronto Rehab Foundation Board. Bob, if you could raise your hand, please. Together with Bob, we have many board directors here. I have not seen them all, but I believe they're here. Brandon Crombeen, Jim Deeks, and Linda Friendly and Bill Trotter and his wife are also in attendance today. I'd also like to acknowledge Julian Fantino. We have Julian Fantino in the audience. How cool is that? Mr. Fantino, who told me to call him Julian, which is kind of weird, but is Toronto's former chief of police and a former member of parliament today. Julian, it's great that you're here with us. So I'm going to share with you a personal experience, and I brought a prop today since we're talking about pain, and Advil. So someone was saying something to me just by chance, made a comment about Advil and Aleve, and these babies I was personally a few years ago very connected to. I'm just going to leave them here as a reminder to me. About 15 years ago, I started developing headaches, and I've not really shared this publicly. My friends and family certainly know, but I started developing headaches, I think after I had my children, and they were brutal. I would, and verging on migraines, I would experience 3, maybe 4 pounding, what I would call pounders, every single week. And let me tell you, I'm from an immigrant family. Our motto was, you never stop, you go, you work hard, you drive, and you succeed. And so for about 15 years, actually not quite, maybe a dozen years, I didn't call in sick to work. I had young children. I pushed, and these, I don't want to say they saved my life. They didn't. They were actually really bad in the end. But I relied on Advil and Aleve to just see my way through many days every single week. I'll tell you, I would wake up in the mornings and I can't even look out at the audience talking about this. I'd wake up in the morning with a pounding headache, and the first thing I would do is put on the coffee so I could get some caffeine into my system to help. And I would take 4 extra strength Advil, hoping that I could knock back the headache. 4 extra strength Advil is about 1,600 milligrams. If I was lucky, it did push it back a little bit. I'd take probably 2 more on my way into work, and I'd have several over the course of the day. I was up to about 10 or 12 extra strength Advil a day, many, many times a week. I would go through one of these, which is 72 Advil in about 2 weeks. And the really big mammoth ones, I'd go through easily one of those every single month. So what was happening to me? I was not a mess, but I was taking care of my children. I was making my way through every single day, and I was doing a fairly decent job at work without people knowing that I was in a whole lot of pain and walking in a fog for a whole lot of time, years. So by chance, about 4 years ago, my husband and I decided that we would make a slight shift to our diet, not because of my headaches, not because of anything. We wanted to lose a little bit of weight. And I'm not going to tell you what the shift in the diet is. If you're interested, you can ask me later. Like a modest shift. We didn't go on a diet, it was just a shift in our diet, really. And the first thing I noticed after about 2 weeks was my headaches. They've disappeared. I haven't had a headache in 2 weeks. And again, 3 or 4 verging on migraines every single week I had before that. I can tell you that I haven't had a headache in 4 years. So I didn't expect a clap, but I guess the point is 2 points I want to make is that this kind of stuff is great. It serves a purpose. But there may be other approaches to pain and managing your health that are more holistic in nature, and I think we're going to touch on that a little bit today. The problem with Advil and Aleve for me was that they made me bloated, they made me tired, they knocked back the headache, they made me foggy. You get rebound headaches. So you just get worse and worse and worse. When I stopped taking those, when I changed my diet, I can also tell you that I felt better. I started exercising. I started changing other aspects of my diet. Kind of life opened up, and the fog and the cloud disappeared. I would tell you that those that know me really well would say that I'm a different person now than I was 4 years ago. And I can tell you that I feel younger than I did 15 years ago. Crazy. Okay, so there's my story. I thought I'd bring my prop. It's real. A lot of times pain's a funny thing, right? You don't know when someone else has experienced it. You can't necessarily see it. But it's a very real thing, even when people appear to be functioning very, very well. I wasn't. I was on the surface looking pretty good, but there was a lot in the background going on. Okay, enough about me. I feel that was great group therapy. Thanks so much for listening.